Well, it's a pleasure to discuss the Peripheral Arterial Interventional Program at the upcoming Charing Cross 2016 Symposium. It really does look like a fascinating program. It's scheduled on the first day of the Charing Cross Symposium. That's the Tuesday, the 26th of April. The morning is going to kick off with a discussion of an age-old problem, really, the role of exercise therapy in claudicants. With such a range of endovascular techniques we now have for femoral and popliteal artery intervention, just what is the role of exercise therapy? We're really going to then move on to a very hot topic we all know about, that is drug-coated balloons and the impact in the superficial femoral and popliteal arteries. We're going to kick off with some basic science and some clinical information as to why we should be using pre-dilatation prior to the use of drug-coated balloon angioplasty. And then we're going to hear from the principal investigators of the three major randomized controlled trials using drug-coated balloons in the superficial femoral artery. That is the IMPACT Superficial Femoral Artery Randomized Controlled Trial, the Levant 2 trial, and the Illuminate Global trial. It'll be fascinating to hear the latest updates of these important trials that really influence our practice. We'll also dive into some subgroup analysis of interesting things such as drug-coated balloons in chronic total occlusions. Exactly how do they perform in this subgroup of patients? Already having dived deep into the drug-coated balloon topic, we're then going to switch focus to stents. Not only are we going to hear the latest information on drug-eluting stents in the femoral arteries, we're going to hear some new stent designs and how they perform. And then we're going to dive into a very fascinating session on in-stent restenosis. What is the pattern of restenosis of different stents, and what is the optimum treatment modality for this problem? Actually, in the afternoon tea session, we'll also hear some more on stent technology, including covered stents, and that should be a very interesting symposium. You know, one of the sessions I'm really looking forward to is the management of long superficial femoral artery lesions. This is always a hot topic and it's constantly moving and changing. And the Charing Cross Symposium offers us an opportunity to get the latest information on how to manage these patients. Should we use drug-coated balloons for these long lesions? And if we use stents, should we do spot or sequential stenting or full metal jackets? Should we use other techniques such as atherectomy? These are all fascinating topics, and we should, by the end of that symposium, have an understanding of, in 2016, how to manage long lesions. Another session I'm really interested in is the session on the popliteal artery, and particularly the problem of popliteal artery aneurysm disease. Just where are we at in 2016 with endovascular treatment of this condition? You know, stent grafts promise so much, but they're compared against the very durable open surgical repair, and we should get an update on exactly where we are with endograft treatment of popliteal artery aneurysm disease. Later in the afternoon, we switch to the very important subject of critical limb ischemia and tibial artery intervention. And there'll be some very interesting presentations on the latest imaging modalities for evaluating patients with critical limb ischemia and trying to identify the patients who are going to benefit from endovascular therapy and exactly how much endovascular therapy should we offer these patients. The final part of the day will be dedicated in a multidisciplinary way to the management of wound healing, and surprisingly there continues to involve some new technologies that are really assisting in this common and unfortunate problem. So as you can see, the Peripheral Arterial Day at the Charing Cross Symposium in 2016 is really exciting. It should be fascinating with a combination of the usual hot new topics, some debates, and opinion and discussion. I'm really looking forward to it and look forward to seeing you there.